Hi, you guys. Welcome back for our daily practice questions. It is day 177 and our Pharm series continues. But as always, I like to start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminders that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and it houses all of my resources for first time test takers as well as those who may be retesting. But let's get into question number one, you guys. Question number one states a 30-year-old reports locking and clicking in the knee after twisting while playing basketball. McMurray's test is positive. What is the initial management? Is it A, immediate surgery? Is it B, immobilization with casting? Is it C, activity modification, NSAIDs, and physical therapy? Or is it D, corticosteroid injection? Take a moment and tell me what you got in the comments, y'all. All right, stem of the question states, what is the initial management? All right, so we need to look and see if they provided us with a diagnosis, and they have not. So let's see what the assessment findings show us. So we have a 30-year-old reports locking and clicking in the knee after twisting while playing basketball. And we have a positive McMurray's test. Y'all, this is confirmatory for a meniscal tear, right? So for a meniscal tear, although we do want to instruct them on activity modifications, you can give NSAIDs, but you want to refer them to have surgery, okay? Question number two, a 25-year-old hears a pop in the knee while pivoting. There is swelling and a positive Lachman's test. What is the best next step in an active patient? Is it A, NSAIDs and brace? Is it B, corticosteroid injection? Is it C, surgical referral for ACL reconstruction? Or is it D, compression and elevation only? Take a moment and tell me what you got, you guys. All right, so stem of the question here states, what is the next best step in an active patient? So let's see what's going on. So we have a 25-year-old. They hear a pop in the knee while pivoting. There's swelling and a positive Lachman test. This is classic for an ACL tear, right? Lachman tests are for the ACL. Remember, McMurray's is for meniscus. Pay attention to the testing. Make sure you know these so that you are not tripped up. Remember, I always say things that present similarly. You have to know the key identifiers on how to differentiate them, okay? For exams as well as in practice. But with a positive ACL tear, you want to have a surgical referral for ACL reconstruction, okay? All right, in question number three, a 28-year-old presents after a dashboard injury with posterior knee pain and a positive posterior drawer test. What is the best initial management? Is it A, urgent surgery, B, Rice, NSAIDs, and quadriceps strengthening, C, immobilization and full extension for 6 weeks, or D, cortisone injection? Take a moment and tell me what you got, y'all. All right, so what is the best initial management? All right, so no diagnosis is provided. So we need to look at the breakdown in the assessment findings. So we have a 28-year-old who presents after a dashboard injury with posterior knee pain and positive posterior drawer test. So with this is more of a PCL injury. So you want to initially do your Rice, your NSAIDs, and quadriceps strengthening. And of course, if this does not provide any resolution or improvement, we're going to refer out for potential surgery. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one, at gmail.com. Everything that I do offer is linked in the bio of this channel, as well as my website. And my website is also linked in the description that houses all of my resources. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.